I wanted to talk to you a little bit about your spine. And why do I want to talk about your spine? It's because your spine is incredibly important. And there's really only two things I wanted to share with you today, and that's specifically what we would look for here in the office when you come in for an exam. The two things I need to see in your spine to make sure you're healthy and pain-free are, number one, structurally, what does your spine look like? And functionally, how's your spine moving? Because if you have a spine that has good structure and good function, not only will it last you 80 or 90 or even into your 100th year, but you'll also have a spine full of energy and vitality and healthy, pain-free movement. Okay? Does that make sense? I mean, I think that should make just logical sense if you think about it. If your spine has good structure, so structurally, when you look at a spine from the front this way, it should be perfectly straight. Okay? And when you look from the side view, we all know that there's three curves in your spine: your neck, your middle back, and your low back. So we want to make sure your three curves are in the right places and your spine is straight. And a lot of people are surprised to find out that structurally, a spine can get in a really bad position really fast, i.e. early in life, and that starts causing a lot of problems for that person, even young people. But of course, as that spine ages, it gets harder and harder to correct. So that's why structure gets absolutely so important in making sure we keep you healthy and mobile into your olden years. Now, function is the second thing now, where we see structure as a very objective metric. Your function is a bit more subjective. It takes some palpation, so some hands-on exams to see how your spine is moving. So when a spine develops areas of high stress or high tension, this is what we call subluxation. Okay, and that's a shift or displacement of the spine out of its normal position. Okay, and with a good exam, even in a clinical setting without any further imaging, you should be able to see structurally and functionally how your spine is doing. And if you've been struggling with back pain or neck pain or headaches or sciatic pain or any kind of numbness and tingling in the arms and the legs, well, you may have sought treatment before. But the way the body works is very simple. If you have structure that is in the normal and you have healthy function, so good structure, good function, you will have a healthy spine that moves well with no pain. Okay? So, and I'm touching on that because if you've been struggling for a while and you haven't had the proper exam, that's the first thing anybody needs to do who needs help to get healthy and mobile and active. Go right to the core, call that inside out, right? Your inside has to function really well in order for you to live well through your body. So the proper exam has to start at your spine and your nerve system. And the two things we look for, just to recap as we round up here, is good structure, good functions, means you have a healthy spine for your whole life. Take care, guys.